This section of our clinic is what comprises our clinical area, where our providers, dentists, and hygienists provide services for our patients. As we come over, we'll see that each of these chairs are the same. This is a dental chair, a mechanical chair, and it is adjustable. The height of the chair can be adjusted by turning the crank. This is the vertical adjustment, and then the backrest adjustment has a clip that we just simply squeeze and bring the chair down, and then when we're bringing the chair back up, raise the back. And those workstations that have computer terminals at them are the workstations that the dentists work from. Those that don't have the workstations, as we see here, are those where the dental hygienists will work. Otherwise, every operatory is equipped the same. And what we have here, as we mentioned in our previous video clip, this is a bottle that provides the needed water for our ultrasonic planer and for our power drills. And so this will be changed intermittently as we are using that. And so that can be taken to the sterilization area for refill. On the opposite side of the cart, we have another container. This is the waste container. So all the liquid waste that's gathered from the patient via this suction tube is collected in here. We have an individual that is designated to empty that. We want to make sure that this container is emptied before it approaches the halfway mark. Otherwise, there's a risk of it overflowing. That's the reason why we have plastic on the floor. Here we have our high vacuum suction tip. Operates by simply depressing the button. We have our air water syringe with the button for water and air, or when they're both pressed simultaneously, you get a mist. These are the two air connections for the handpieces. They are activated by means of a toggle switch that is here in the corner. So this is handpiece tube number 1. This is handpiece tube number 2. I would say that this one has water circulating through it, which is controlled by a little toggle switch at the foot pedal. When it's set towards the blue dot, it's activated for water. To turn the water off, we simply turn it away from the blue dot. This handpiece does not have water to it, so this is the handpiece that the hygienist would put their polishing handpiece connected to.
Okay.
The dentists generally operate with water. All the operatories, again, follow the same logic in terms of their function. Here we have an ultrasonic scaler that's used by both the dentist and the hygienist. Here we have a supply box that provides all the needed supplies for the delivery of restorative procedures. We have our curing light. We have our amalgamator, which is here, and then our sharps container and all the auxiliary equipment. Patients can access the radiographs of their patients by simply, with the software program open, they just simply enter the patient's number or the patient's last name, and they can access the patient x-rays. And that's it.